Good afternoon, everyone. Anthony Darby, Peninsula Alternative Health and Peninsula Wellness. Thank you for tuning in to another one of our Lunch and Learn series. Like everything we do, there's always going to be a little evolution of these things and how we're going to adapt them. One of the things that we're going to do a little differently is we're going to shorten the time format a little bit, be closer to like the 15 to 20 minute time frame, not the half hour to hour format that we were doing before. I think this gives the listener a much better opportunity to cue in for 10 or 15 minutes and actually learn something and then go back to doing whatever you guys are doing. So today I wanted to go over the benefits of Maryland's cannabis program. I think sometimes I'm still surprised at some of the ambiguity around the program. How do I get a card? How do I qualify? And some folks are still on the sideline, standing on the outside, watching in and kind of waiting when's the right time. When I think about where we're at in the program, I'm going to go over a couple different things. I'll talk about the history. I'll talk about the patient process, the dispensary experience, and then how we can help. But there's been so much growth within the program. And if you're on the outside, you still haven't joined yet, you're going to join in a much better time than maybe some of the folks that joined in the very beginning. So, like I mentioned, we celebrated our 3-year anniversary on December 6th, and we were one of the first dispensaries that were open in the state. So the program has been operational and serving patients for about 3 years now. At this point, there's 18 growers, there's 18 processors, and there's 91 dispensaries to choose from in the state. I say this because the supply at this point is much more robust, and the product selection is much more sophisticated than when we first opened up. When we first opened up back in 2017, we had 5 strains of flower, awakening tabs, relaxing tabs, and synergy tabs, and that was it. It was really a very, very small product count, and things were expensive. Your price per gram was closer to $15 to $17 a gram, where now we've seen it table off. It's closer to $10 a gram right now. So when you think about versus the street prices, you're still incredibly competitive with the street for pricing. So as I'm talking, some of the things that I want to highlight is just like I mentioned, the supply. Through the last 3 years, because of the influx of growers and processors, because of the maturation, when you walk into a dispensary, you can expect to have a choice of at least 10 strains typically, and sometimes up to 25. You're going to have a choice of typically 20 to 30 different vape options. And then when it comes into ingestible products, tinctures, tablets, you're typically going to have 30 to 50 options on that. So your product offerings and have really gotten to a point now where in the very beginning, it was tough for us to differentiate ourselves. But at this point now, the things that we have in our dispensary are light years in sophistication ahead of what you'll find on the street. And they're all third-party lab tested. So just go over some of the quick benefits of why you may want to join the program. I mentioned that now we have supply. The costs have gone down. Besides the knowledgeable staff that you'll run into, if you pick the right dispensary and you go there, your patient experience will be much different than what you may perceive and what you're thinking. Even if you used cannabis in college, if we hung out in college and we were using cannabis together, and you think, "Oh, I know about cannabis." No, you don't. I assure you that when you walk into a place like our dispensary and you're able to sit down with a patient services consultant and really understand how cannabinoid-based therapy works, understand your endocannabinoid system, you get a much better understanding of how you can treat yourself and how cannabis can be used as a medicine, maybe not just a relaxation tool that you may have used previously in other circumstances. Our program is over 110,000 patients at this point, and I think that's a testimonial to the adoption and why patients are feeling satisfied once they join the program. We see a lot of almost all the patients are renewing their cards and they're staying in the program because they're seeking out these benefits and they're getting those rewards by being in the program. It's an interesting time with everything going on. But there's a lot of pieces to the actual process of, it's okay, Darby, I hear you, the program has grown, everything seems to be a good timing for me, but like now what do I do? The patient process right now because of COVID is actually a lot easier than typical. There's there's kind of two ways to address this. So if you're someone that is autonomous and you want to do this yourself, there's a 3-step process that I'll walk you through in a second. If you're not, if you're someone that's timid by nature, if you're someone that's maybe not savvy technologically by nature, and you have concerns about how you would do the registration process, you don't even have to do it yourself. I mean, you can simply just reach out to us directly, and we have these services in-house. We can walk you through the process. We'll help take your picture. We'll help do all of the data gathering that you're going to need. It's required for the state to get the ball rolling. Okay, so if you're concerned or you're scared, understand that you don't have to do this on your own. You can simply just reach out to us, and we'll walk you through this process. But I want to make sure that I put some information out there, because the things that we're talking about today, they're not just for patients on the Eastern Shore or our local patient population. This is for anyone in the state. So if you're listening and you're wondering how do you join the State of Maryland program, there's 3 steps to actually getting into our dispensary. Step one is you're going to register with the State of Maryland. You need to go to the MMCC's website, maryland.mmcc.gov's website, and you can just Google Maryland MMCC, and they have a box on the landing page that says register to be a patient. You're going to need a couple things. You're going to need to be able to take a picture of your driver's license. You're going to need to be able to take a picture of yourself behind a white background, not smiling, that is clear for them to verify a current picture. If your address does not match the address that is on your driver's license, you're going to need 2 forms of proof of address verification. And that's it. You're not going to need anything regarding cannabis. You're not going to need a doctor. This isn't part of the process where that happens. The part of the process that you do in the very beginning is simply just a registration for a database. You're basically giving Maryland your information. The state of Maryland is going to do a quick check, and they're going to verify that you are who you are, you live where you live, and then assign you a 16-digit patient identification number. That 16-digit patient identification number is really the only tracking mechanism within the entire state to be able to find out where you've been, what you've purchased cannabis-wise. A little off topic, but for those folks that may be concerned about privacy, that's an important fact. No one's able to just put Anthony Darby's name into a database and see that I'm a cannabis patient. They're not able to put my name, address, social security number into information and see whether or not I use cannabis or not. They would actually have to have your 16-digit patient ID, and the only way they can get that is from you. So it really is a lot of built-in privacy within the process. So you will put in that information, you will take your picture, you will submit your driver's license, and you will send in $50 to the state, and that will cover the card fee. A quick note, if you're on Medicaid, you are able to fill out like a waiver box, and they will waive that fee for you. But for everyone else, you want to make sure you have a card handy as well, so you can give that $50 application fee. All right. So you've gone through the process. You've submitted everything with the state. Now you're going to wait 3 to 4 weeks. Is what a typical turnaround can be. It can take a little bit longer. If there was any incorrect information, the state may come back and ask for additional information. But let's assume that you put in everything correctly. 3 to 4 weeks come, and now the state's going to send you an email that says you've been registered with the state of Maryland. At that point, and that point only, once you have that 16-digit ID and you are registered actively with the state, then you can go see a certifying provider. Now, certifying providers. Not every physician out there and it's certifies for medical cannabis, and it may be somewhat unlikely that even your primary care physician certifies for cannabis. If your primary care physician does certify for cannabis, that's phenomenal. That's one less step that you have to go through. If your primary care physician does not certify on cannabis, then the state actually has a database that you can pull up, easily access, and see all the listed registered certifiers within your area. And then you would simply contact one of those certifiers and begin the process and dialogue that would get you to your card. I want to go into that process and dialogue a little bit as well, because some of the concerns that I hear often are, I'm not sure if I qualify based upon what I want to use cannabis for, and what I want to use cannabis for is not listed as a qualifying condition on the website. Have no fear. When I looked at the annual report from the MMCC for 2020, and they rank the conditions in terms of which folks got cards, chronic pain was number one, which is no surprise. We deal with a lot of that in our dispensary. But number two is other. So, folks, what I'm telling you is that when you have these, and I'm actually registered under an other. What I am certified for is not one of the 12 qualifying conditions, but the physician and provider believes that I have a reasonable expectation of improving my quality of health utilizing cannabis to treat this, and that's why I got approved. The majority of the providers out there are willing to do the same thing. So when you sit down with these providers, try to take some of the armor off and try to take some of the fear out of this and try to have that conversation. If these folks are certifying for cannabis, they're believers in medical cannabis. They believe that this is a tool that can help people. You don't necessarily need to over-exaggerate. You don't want to be anything other than completely honest with these folks of what you're doing and how you intend to treat yourself. And as long as it's within a medical context and, you're on the right path and where you need to go for your treatment, you're going to have the approval that you're looking for. It's not something where, we find that we have drones and drones of folks that I just wish I could get a provider to believe in what I'm doing, and I wish I could get a provider to certify me. That's not the case. If you need to get certified, there's plenty of providers out there that are reasonable and that are willing to understand your medical context and give you that certification. So, just to recap, you went to the state, you filled out all the information, you submitted your pictures, you verified your address, and they assigned you a 16-digit patient ID. Check. Step 2. Now you went to a provider, and because of COVID, it was probably a telehealth appointment. Almost all these certifications right now are happening over the phone. So it may have been something as simple as you called the physician or provider, explained that you were looking to obtain your card, you gave them your information, you had your telehealth consultation, they've approved you, and now you have a certified provider who has certified you, and you have your registration with the state. You are now ready to walk into a dispensary. It probably took you roughly 4 weeks or 6 weeks to go through this entire process. About a month and a half is what I typically tell people. But now that you're here, you are good for the next year without having to see your provider again. So, what are you going to do now that you get to the dispensary? I wanted to kind of go over some do's and don'ts so that, once again, anyone listening across the state, not just folks trying to come to our dispensary, but anywhere, can get some value out of this. So, I think the most important thing to think of as a new patient with your certification, whether you are very experienced in cannabis or whether you are THC naive, is that not all these dispensaries are created equal, okay? And not all of the dispensaries are going to provide the same patient experience. And depending upon what you're looking for, it's important to do your research and identify a dispensary that you think is going to meet your needs and goals. Almost all these dispensaries now have a social media presence. A lot of them have an online presence and websites. I would really implore you, don't just drive up, see that they have a sign out front that says they're a dispensary and walk in without doing your research, because depending upon what you're looking for, you could really be put off. If you're looking for a really clinical or medical experience, you're going to be a little bit more narrow in your scope. You're going to have less options out there where you can go. If you're someone that's looking for just a wide variety of products because you're a connoisseur and you're looking for that kind of spice of life, or you're someone that's quite honestly, you're looking for more of a rec vibe, you can find that as well. So depending upon what you're seeking out there, is a research and is kind of an exploration that you want to do before you even show up to the front door. Once you're there, I would ask you, if it's your first time to a dispensary, to allow yourself to take in the experience. Don't just assume that you know everything. Don't be Johnny Know-It-All. Allow yourself to kind of have that growth mindset and put yourself into a learning mindset and walk in. There's a lot of information, and it's put together in a way in a lot of these dispensaries that are credible, in a way that even if you are you've been using cannabis for 30 years and you understand terpenes and cannabinoids, you can still learn something. You still pick up on things. You still understand the specifics with Maryland's program. So you're at the dispensary, you're going to have an open mind, you're going to go in there, and you're just going to want to be honest with them, okay? You want to try to give the benefit of the doubt that The dispensary agent, because you've done your research, is not going to try to sell you something that you don't need. They're not going to try to do anything of ill will. And they're really going to be able to utilize their experience in waiting on people day in and day out to set you up with a product and be able to guide you through that product selection experience better so than you would have been able to do on your own or just go into an online menu. Talk to them about the symptoms and really talk to them and try to understand some goals and outcomes. That will help set expectations both for you and the agent that's helping you, so that if your expectations are completely out of whack of, my pain's a 10, it's been a 10 for the last 7 years, and I think all of a sudden I'm going to smoke cannabis for the first time and my pain's going to be completely alleviated. If you have that type of a conversation with an agent, ideally they're tabling that and they're saying, look, if you've had this pain for forever, then let's see if we can knock it down 3 or 4 notches. Let's see if we can just make an impact first. Let's not necessarily set the goal at an all or nothing mentality. A lot of the expectation setting helps our patients because just like every other medicine, you're going to need dosing iterations. You're going to need to try different products. Not everything is going to work that you purchase. It's got to be like an experiential thing. I find that our patients that are the most disciplined and that are the best communicating their experiences to us, they journal, they're the ones that have the quickest and greatest outcomes. So come to that dispensary the first time kind of willing to learn and being willing to have some questions pre-planned that you want to throw out there and get the value of that. I mean, the value is not just in the product itself. It's got to be in that full experience. And I think being an informed patient, but then also being a curious patient and having that will and want to learn as a patient will really provide a catalyst for you to get those outcomes that you're looking for. Some of the things that will kind of be turnoffs to any dispensary agent, don't just come in asking for the highest THC level. Things like that indicate to agents that you don't have a great working knowledge of how cannabis works. It'll indicate that maybe you're not seeking a therapeutic outcome, that you're maybe just looking for that stoned feeling. And you may get off to a wrong start. If you're someone that's got a high tolerance, you need high THC, there's nothing wrong with indicating that. There's really nothing wrong with explaining that at all. But make sure that you're mindful that there's other things in that plant that are going to have an impact. And if all you do is come in preaching, I need the highest THC, it's unlikely that you're going to get matched with a top product that you need. It's likely that agent will then just try to satisfy you, give you the highest THC content product. You walk out the door thinking that, hey, I got what I want, but you really didn't get what you need. So with us, it's about allowing and taking some advice from us. Be willing to come out of your comfort zone. If you've never done anything other than flower, don't just say, hey, I've never done anything other than flower and say that's how I'm going to be for the rest of my life. Be willing to say, look, flower is what makes me feel comfortable, so I'm definitely getting that. But you know what? Maybe I'll try a lozenge, or maybe I'll try a topical for localized pain that I've never tried before, and I'll see how that works and use my flower. There's a lot of trial and error to be had here, and a lot of opportunity to experience different methods of administration and play around with things. And by creating that dialogue with your dispensary agents and creating that experience for yourself, I think patients will be a lot better off. And I know that it can be intimidating. I remember the first time I walked into a dispensary in Colorado, I really wasn't sure what to expect and how things were going to go. And I was lucky to have a really great agent who just took the time with me, allowed me to go and be educated about the different strains that they had. This was pre-COVID, so I was actually able to smell the strains and kind of have an experience. And that was my very first legal experience. So for me, it was really everything that I wanted in an experience, because, I used cannabis very, very often and illegally for a long time. But when I went to that legal experience, I wanted to be able to have open, knowledgeable conversations without having to feel like I was breaking the law. And this is what we foster really well within our dispensary. This is a safe place for real conversations to happen that allow us to drive patient outcomes that we don't see in other dispensaries. So, we are here to help. If you live close, it's a no-brainer. You can walk in the door Monday through Friday, 10 to 6, to 40-ish. And on Saturdays, 10 to 4:30. On the wellness side, which is open to the public, just walk in, see one of the sales associates there. If you need help getting signed up, if you need CBD, if you need guidance on any of these different things, just come in, let us talk to you, and let us help you out. If you don't live in Salisbury, we have a much broader reach now. We have the ability to service patients throughout the entire state. We actually have satellite associates that are not just on the Eastern Shore, but on the other side of the bridge as well. If you need that face-to-face interaction, Peninsula Holistics, Peninsula Wellness, and Peninsula Alternative Health, when COVID happened, has gone to a much greater offering from a virtual side of things, and we're here to help. So just send us a message. If I can't help you directly, I can point you in the right direction of where you need to go. We want to be the asset to our patients in the community. We want to be the ones that people know they can trust and be the experts when they need help in how to get a card or help a patient or help a friend or a family member. Come to us. We are here to help. So I think that's about my 20 minutes. And, if you have any other questions, like I said, please reach out to us. As always, please like this video, share this video. This is a video that's valuable for anyone that lives in the state of Maryland. So share this widely as you can. Anthony Darby, Peninsula Wellness, PeninsulaMD.com. Thank you very much.